How do I know that my child may or may not need an assessment for being on the spectrum?
There are many factors to consider when you suspect that your child might have a disorder on the autism spectrum. First, the most common symptom is difficulties with speech or speech delay. These can manifest and take place in everyday life, affecting communication with others, with their parents, with siblings, with peers. And they also demonstrate difficulties with social interaction. So they show difficulties with playing with other children. They might be hesitant to go up to children to ask them to play. You might see some other kinds of difficulties with interacting with others, being able to cope with certain social situations. You might also see some repetitive behaviors, such as lining things up or wanting things to be in a certain routine. And if you deviate from that routine, they really cannot handle that, and they might have temper tantrums, which sometimes can be quite seem to be blown out of proportion or outside of what you would normally expect for that particular situation. Sometimes you don't even know what they're having a reaction to. You also might see some narrow interests. So, for example, a child who is obsessed with porta potties or something like that, or manholes, and they need you to stop whenever they see one so they can go and study it, and they know everything there is to know about that. So that's another red flag. Also, some sensory difficulties. If they're having difficulties with certain clothing, with certain textures of food, and so forth, those are some of the things that we look at as a red flag and a potential symptom of autism. To get an evaluation, first you need to talk to the pediatrician, and you need to make sure that they can help you understand if these are outside of the norm or what is typical of a child their age. And if it is out of the norm and you've tried a few things and it still hasn't helped, then probably getting an evaluation by a qualified pediatric psychologist or a neuropsychologist would be essential. And by doing so, you would be able to rule out other issues that might be causing these symptoms. It could be a long process, but it doesn't have to be as long as some parents experience. So the sooner you get help, the better. So I hope that helps.